So before I enter the room, I'm gonna wash my hands. Hi, Mrs. Smith. I'm Shona. I'm gonna be your student nurse today. Is it okay if I do an assessment on you, take some vital signs, and ask you some questions?
Yeah.
Okay. So I'm gonna go wash my hands and I'll be right back. Okay, so I'm washing my hands. Okay, so I'm gonna start with some questions. Can you tell me your name and date of birth?
Katie Smith, 3/14/68.
Okay. Looks correct. And I can tell that you're female. What brought you into the hospital today?
Stomach pain.
Okay, and do you have any past surgeries?
Yes.
Okay, can you tell me what those are?
Kidney tumor and my gallbladder removed.
Okay. Do you have a medical history of like hypertension or diabetes?
No. Kidney stones.
Okay, can you tell me your race or ethnicity?
White.
Okay, and do you have any allergies to medications or food?
No. Oh yeah, Demerol.
Okay. And your code status, do you want it to be a full code or do you not want any life support measures?
No life support.
And do you smoke or consume alcohol?
No.
And are you currently taking any medications or vitamins?
Vitamin D3.
And are you currently having any pain? If so, can you rate it on a scale from 1 to 10?
No.
Okay, so for charting purposes, I would take a look at your physical appearance. And you are clean, you're not curled up in any pain or anything. And as far as body structure goes, everything looks good, no missing limbs or slumping posture. Some possible safety issues though, possibly the throw rug, you could fall. Everything else looks good though. For your behavior, I would say that you are alert and you're pretty oriented. Have you had any mood changes lately?
No.
Okay. And do you feel safe in your home?
Yes.
Are you feeling dizzy or unsteady when you get up?
No.
Okay. So that's all I have for your survey. I'll be back in just a second and I will do some vital signs on you. So I've done my hygiene for entering the room again. Hi, Mrs. Smith. I'm back to do your vital signs on you. I'm going to wash my hands and I will be right back. I'm washing my hands and I'm putting on gloves. So I'm going to make sure the bed's at a good working height. I'm going to put the bed rails down. So is there any reason that I shouldn't take your blood pressure in either arm?
No.
Okay. So I'm going to put the blood pressure cuff on this arm, line it up with the artery, the air that's on it. I'm going to find your pulse. And what does your blood pressure usually run?
140/74.
Okay. So I'm going to make sure the valve is closed and I'm going to pump it up till I hear the first heart sound and that'll give me my systolic. Then I'll let the air out and when I don't hear the heartbeat anymore, that'll give me my diastolic. Okay, so I got you at 137/72. I'm going to take your blood pressure cuff off. Go set that over here. Now I'm going to do your pulse ox. I'm going to go get the machine really quick. So here's this little device. I'm going to get it on your finger. It's good that you don't have any nail polish. Okay, I'm going to let that read. Okay. And I got you at 100. Okay, and now I'm going to take your pulse. I'll do this for 30 seconds and multiply it by 2. And secretly, I will be getting the patient's respirations while I'm doing this, and I will do that for a minute. Okay, so our minute is up. I got your pulse at 64. Nothing was irregular. It all sounded good. And your respiration's at 20. Nothing was labored. It seemed like your breathing was pretty easy. Now I'm gonna take your temperature. I'll go get the thermometer and I'll be right back. Okay, so I'm cleaning it with an alcohol swab. And are you okay to hold it in your mouth yourself?
Yeah.
Okay. I'll have you open your mouth. I'll put it on your tongue, bite down. I'll wait for that to read. Okay, go ahead and let go. Okay, now I'll clean that off and with the alcohol swab, and I will put it back up. And I got you at 36.3 degrees Celsius. Okay, so I got all your vitals done. Now I'm going to do a skin assessment. I'm going to go wash my hands and put on my gloves really quick, and I'll be right back. Okay, so I'm washing my hands. I'm putting on my gloves. Okay, Mrs. Smith, you ready to do your skin, hair, and nail assessment?
Yeah.
Okay. Your skin looks normal for your ethnicity. No ashiness or anything. And your skin temperature is good. I checked that pretty much when I looked at your bracelet. Nothing's cold. And your skin is intact. There's no bruises or lesions that I can see so far. If this was a real patient scenario, I would remove the clothing and I would check everywhere on the abdomen and the breast area, under the armpits, and underneath the arms and everything, and make sure everything looks good. Now I'm going to go ahead and bring the blanket, actually I'm going to bring it up. And I'm going to check your toes. I would check between each toes after I remove the socks. Make sure there's no bruising or lesions, no dry skin. And I would do that for both of the legs. Everything looks smooth and no dry patches or anything. I would go in the vaginal area. But for the sake of the video, we're not going to. Now, are you okay to roll over on your side?
Yeah.
Okay, so I'll go ahead and have you roll over on your side, and you can hold on to the side rail. And I'm going to check your back and everything for the same reason. No breakdown or lesions, dry skin. That all looks good. And I would check the buttocks area. It looks all good. And then the back of the legs. And everything looks good. The heels. Okay, and I can go ahead and have you roll back on your back. So everything looks really good. Okay, so now I'm going to check your hair. I'm checking for dry skin, dandruff, any lice or anything. Use a pen light. And you don't have any alopecia or anything, so that's good. Okay. And when I checked your skin, I saw that, there's no hair in places it shouldn't be. Everything looks really good. Now I'm going to take a look at your mouth. If you want to go ahead and open up. So the tongue looks moist and pink. There's no white patches or anything. And all the teeth are intact. Cheeks look good. Everything looks really good. Okay. So now I'm going to check your nails. Make sure they're not dry or brittle or anything. And I'm going to press on them just for checking circulation. Everything looks good. And I would check both sides. And then now I'm going to check your toenails. I'm going to be checking for fungus or brittleness or anything. So I would take your socks off and I would do the same thing for circulation. Press on them. Everything looks good. So have you had any issues with your hair, skin, or nails lately? Have you noticed anything?
No.
Okay, so I'm going to put your bed back down to the low position, put your bed rail up, your call lights in reach. Anything else I can do for you before I go?
No.
Okay, you have a good day.
Thank you.
And then I would record and report all my findings.